Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this video vignette, I'm going to be talking to you very briefly about the basic changes that occur in the heart during pregnancy. Well, we know pregnancy is a physiological phenomenon in the women, and to meet the needs of the circulation as the baby is growing inside the gravid uterus, more oxygen is required, more nourishment is required, and certain physiological changes therefore will occur. Increased blood volume by 30 to 50% as the pregnancy progresses. Mainly the increased blood volume is from the plasma volume. Remember, the blood volume consists of red blood cells and the plasma volume. So both are increased. However, the increased plasma volume is more than the RBC volume. Hence, there might be a relative anemia. So even if the hemoglobin drops as the pregnancy progresses to the second and third trimester, the hemoglobin of 11-12 is still considered as physiological for the pregnancy. Now, decreased in both systolic blood pressure and diastolic blood pressure occurs because there is vasodilatation, or the vessels in the lower extremities and upper extremities, they tend to vasodilate. So there is not much of a resistance, and in order to take the capacity of this extra blood volume. See, everything is so beautiful in the human body that, you know, as they say, one computer system works in line with the other, if you will. And that's how it is. So if you have an increased blood volume, to accommodate that extra volume, where is the blood going to be? So obviously you need to have more capacitance in these vessels, right? So there's a peripheral vascular resistance to it. Now when the resistance drops, obviously is lessened, systolic blood pressure and diastolic blood pressure drops by 5 to 7 points. Not a whole lot, but 5 to 7 points during the first and second trimester. But in the third trimester, it returns back to the pre-pregnancy stage. We call it pre-gestational stage. There's an increase in heart rate, by the way, and the increase can be up to 25 to 30% as the pregnancy progresses. And during the labor time, obviously, the heart rate is even going up to 50% higher than the normal range. Because that's when the pains begin and the uterus is contracting actively and wanting to send the baby to the real world. So obviously, interestingly enough, the heart rate increases to that level during that time. But 25% increment is totally normal. Sometimes the women or the pregnant ladies can feel a little palpitation, and that's physiological. That's okay, because obviously the heartbeat is faster, a little more stronger, and so awareness of heartbeat itself is called palpitation, okay? Now, LV and RV contractility. Now, look at these two panels here. I have the LV here. This is my favorite schematic, which is always there for me. And here's the right ventricle, and this is the left ventricle. So the left ventricle is sending blood up the aorta, and because there is no resistance, so the blood pressure tends to be a little on the lower side, but this is to accommodate the increased blood volume that's circulating for the sake of the mother and the baby. Now, but the contractility of the left ventricle and right ventricle remains unchanged, but there are some changes that occur within the wall. What happens is, if you were to do an echo, here, let's shift it to the right panel here for a second. If you were to do an echo, which is an ultrasound study and absolutely safe in pregnancy and otherwise, it is using only ultrasound, no radiations are involved, obviously. So the technique, when you do, it shows that the ventricle wall may be a little thickened and the chambers may be a little enlarged or dilated. Again, that's usual to see when you have increased plasma volume. So those are physiological changes where you have wall thickness that may increase and the chamber size that may increase. Both of the right ventricle, left atrium, and RA also has been shown to increase in size. The venous return tends to decrease in the second trimester because of the gravid uterus. Now the baby is growing in the second and third trimester, and the venous return, as we know, is returning back from the inferior vena cava right here, from the lower extremities, and bringing back to the right atrium all the venous blood. So, and the inferior vena cava runs right behind, next to the spine. So when the baby is growing in the tummy, in the uterus, that may compress the inferior vena cava, but that's physiological, and so the gynecologist or the obstetricians will advise the lady to sleep more on the side if possible, so this way the veins are not compressed, and that's totally physiological. The increased cardiac output, because remember, this heart rate increases, so the cardiac output must increase. We looked at the previous equations, my little math whiz video, if you go back and look at it. I'm not a math whiz, by the way, but neither do I want to convert any of you into a math whiz, unless you already are and want to. But the fact is that the heart rate increases, so the cardiac output must increase, even though the stroke volume more or less stays the same, but the heart rate definitely increases by 25%, so the cardiac output should also increase as proportionately. So those are some of the changes we just talked about, and of course there are hormonal changes which we know, because the estrogen and progesterone, those are your pregnancy hormones. They will definitely be higher, and they actually contribute to the vascular resistance lowering effect that occurs, because they are vasodilators. And the RAS system, which is mainly sodium retention and water retention to expand the plasma volume, so the RAS system increases. Now you'll have to refer to RAS at some other video, which I'm going to be doing or have done at in my other sections, but just remember, estrogen, progesterone, and the RAS system, they all increase. I thank you for your attention and looking forward to talking to you more. I hope this was interesting. Bye.